So my name is Jess. I'm a medical student from Sheffield, and I'm going to be sort of helping facilitate this session, which is building the health movement for a Green New Deal. Just really excited to be here with this really incredible panel of people, and I'll just introduce them now. So we have Rhiannon, who is a medical student from Cambridge and is also a policy and advocacy director for Students for Global Health on the National Committee. We have Aarash, who is a respiratory doctor at Bart's Hospital in London, and he's also a member of Medact and Doctors Against Diesel. And we've got Minna, who is an acute medicine pharmacist in the northeast of England, and a member of Pharmacy Declares as well. And we've got Alia, who is a psychotherapist, a busy psychotherapist, and a chair of and the chair of the NHS and Staff Voices and Keep Our NHS Public. So yes, we're very excited to have all these people. I'm not sure is Lesley here? No, okay. So we might have someone joining us later, but we've got that wonderful panel for now. So just gonna start by kicking it off with some questions. So how we wanted to run the session was just to have a bit of a discussion about where we see, you know, after hearing so many incredible things, incredible, sad, inspiring things this weekend, how do we take that forward and how do we build this movement as for Health for a Green New Deal? So I'm just going to start off by asking, so what is the role of health workers and students in advocating for climate justice and for a Green New Deal? So I'm just going to pass it to Aarash, if that's all right, to get us going. And also if you feel like you want to introduce yourself as well, that'd be fab, just a bit more.
Sure, no, thanks Jess. I think you've introduced me brilliantly. I'm a respiratory reg. I'm working in London and a member of Medact, and I was lucky enough to get involved with these guys and help the sort of deliberative process of writing the briefing. So yeah, what is our role and why is it sort of incumbent on us as people that work in health to be involved in this space? I think it's a really important question. For me, I think it's about what I've seen, and it's about the fact that I look after people with respiratory problems, and that puts problems like air pollution to the front of my mind. And in my daily clinics, I sort of hear a lot about people being affected by those things day to day. So I think across the board we can see the effect that we're talking about and warning about perhaps a little bit more clearly than other people because we work in health. Another thing is that I think part of the process of writing a briefing and producing sort of campaign materials is that as people who work in health, again, we might be in a little bit more of a position to be able to read evidence and understand and synthesize evidence and communicate that to other people. And that sort of makes us, I guess, gives us a bit of a powerful role and a standing that makes us important players. We've got a potential to really amplify our voices. And I think part of that is perhaps we are trusted in certain ways because of the types of jobs we do. So I think it's about the reason for us being involved really is about what we see and the sort of abilities that we perhaps could bring to the movement.
Thanks, Aarash. And Minna, you happy to jump in on that as well?
Hello, everyone. So yeah, I'm echoing what Aarash said. I think as well, I've seen a survey recently done by Ipsos Mori on what profession, what kinds of profession that the general public trusts. And I think nurses came out the top at like 93%, and doctors are 91%, and then you have your care home workers around 70-something%. So we are in a position of trust. So, and like Aarash said, like we can read evidence and appraise them. And we give people information on kind of the data, the sciences behind on what we were talking about. So I think we're really in a very good position in cascading a message that in a unified voice as well, and across the sectors of what we want to tell people.
Yeah, thank you so much. I think that's so true about the trust as well. Yeah, Rhiannon, did you want to jump in?
Yeah, I think like one of the ways in which I see the roles of like healthcare professionals is also about the framing and how we envision what a Green New Deal is, both in the UK but also globally, because I think what we can do as health professionals is we can really show how the Green New Deal is about more than reducing emissions, and trying to get away from this idea that climate action is, you know, like a nice extra thing that just focuses on emissions and carbon. But I think as health professionals, we really have the ability to communicate how it's actually about the transformation to more sustainable and more healthy societies. And so, for example, we've got some good examples, like air pollution is one example, but so are health inequalities. And we talk very eloquently about health inequalities, and it's very easy to link that to the principles of the Green New Deal, and also to link it to the, like, make it real for people in their lives. I think that's another thing that health professionals can add is, no, it's not about emissions, because it is about emissions, but with the way that we communicate as health professionals, we can make it about much more than emissions, and having that vision for a world in which every decision we make, we prioritize the health of people and we prioritize the health of the planet in all of our decision making. And one of the really key things which I think it's really important to articulate is these are things we would want to be doing even if they weren't causing global warming. So even if, you know, none of this was going to result in this temperature rise, having huge polluting factories in poorer areas of the country contributing to like ill health disproportionately and marginalized groups is not something we want in our society in the first place. So I think it's really important for health professionals to point out that actually we're not losing anything. You know, we're trying to stop the climate crisis, but we're also stopping and tackling issues that we don't want for our communities in the first place. So I think making those links about like what we're trying to move away from wasn't good for us and wasn't good for our health and wasn't good for equality, and helping to build that more holistic vision of what the Green New Deal is about and why it's so important to think about it as something that reduces inequality, improves people's quality of lives, and turn it into a really nice vision for the societies that we want to see. And I think, yeah, we have a really important role in doing that as well.
Amazing. Thank you so much, Rhiannon. I think I picked up on a key thing. Well, for me, it was a key thing, making it real in people's lives. I think that's, you know, science can sometimes feel far off, and I think health is a really interesting interplay there. So cool. Thank you for sharing that. And so we go to the next question now, which is, so we've sort of talked about the role of healthcare professionals, but it's how we organise and what sort of spaces we can organise health as healthcare professionals and students. And so whether that's Royal Colleges or trade unions or local communities and workplaces. Yeah, so just going to throw that back to you guys again. Alia, did you want to?
Yeah, hi everyone. Thanks for inviting me and for introducing me so well. I'm not the chair of Key Rangers Public though, so just in case I got a bit confused, I'm the chair of NHS Staff Voices, which is part of it. Key Rangers Public is huge and really specialised and lots of really, you know, very experienced people. So yeah, I just wanted to add that. But yeah, I think organisations such as Key Rangers Public are quite good, obviously, but I won't go into that. I think being involved in your union is very important. You know, I'm going to sort of link it to staff, obviously, in the NHS and pay and things like that. And, you know, but the NHS is huge. It's a huge institution. It's a huge infrastructure. And therefore, it's very important what happens to the NHS, and it links to millions of people, people working in it, people who rely on it, and people that don't have the fortune or the sort of luck to rely on it as well. I agree with what Rhiannon was saying and what everyone said, really, that it's really helpful to contextualize things that can seem very abstract. So, you know, even with the environmental issues, which there are numerous, but people just do see them as being quite far away, even though they are completely linked to our existence in everyday life. So contextualizing it as health workers, for example, it's really, really important. And having health workers as advocates for health justice, basically, it's very important. And Medact is incredible. Docs Not Cops is incredible. Really, really, really good ways to link all of these things up. But yeah, I mean, I suppose maybe this isn't necessarily answering the question as much, but you know, in terms of thinking about migrant charges, you know, we've got 600,000 people excluded from accessing health, and you know, healthy, educated people make a stronger society and therefore a stronger economy. So, you know, it's important for people to understand these things and to talk about these things and have the opportunity to talk about these things. So I suppose even just talking about these things more openly, more readily, it's really important. I'm going to link it to privatization as well. It's wasteful, it's costly, and well-funded public services are therefore greener, they're more cost-effective, you know, and these things are very important as well. So any organizations that sort of think about these things are going to be very, very important. The reason trade unions are obviously really important is because, you know, the pay issue is important, and recruitment and retention problems within services are not going to be helped if people are not being paid properly. So being able to sort of be involved in a trade union and say, listen, we need to be paid better, we need to be able to do our jobs properly, and to do that we need to be able to put food on the table, but we need staff, we need colleagues to help us do the work. So it is very important to be part of a union or be part of any organization that works towards these things. I think, you know, the pay rise, 1% pay rise, just to contextualize, it's a real term pay cut, or a real time pay cut even, of £25,000, £2,500, sorry, I'm just getting my numbers mixed up. For paramedics and radiographers, it's almost £3,500 cut. For porters, it's £850 cut. So it's not a pay increase at all. But I don't know if I'm saying things that everybody obviously knows a lot about. But these things are really important to think about. I won't say too much just in case I want to come back on any of the other questions, but I suppose it's become very obvious to people, and through coronavirus, I guess, the crisis, a lot of other things have become very, very obvious to people, and it's exposed capitalism as a virus, I guess, and the harmful and corrupt nature of it, and that links obviously to what people must have been talking about over the weekend, and I'm very sorry to have missed it already. But I think there is a widespread sense that the government's priorities have been wrong from the beginning of this crisis, and there is a huge sentiment. There's a huge sense that things have to change. So people are more open to having these conversations and getting involved in these organisations, because they don't want to go back to normal, because it's not going to work for the planet, it's not going to work for the people, and it's really quite dangerous. In terms of privatisation, for example, you know, parts of the NHS shouldn't be run privately or privately owned, because we've seen now over this time that it's not, you know, these companies are particularly incapable of the things that they're being paid extortionate amounts for, and that money is public money, and that money should be going back into the NHS, and you know, it's just very wasteful in numerous ways. So even sort of getting involved in Keeping NHS Public is a good way of kind of joining these dots together as well, because it's very much about prioritisation and why it's wasteful. Money kind of, you know, it's wasteful in so many ways, as you can imagine. You know, these private owned companies doing things. I mean, I think 23 billion was wasted on the track and trace service, and that money can be going into things where it's needed, obviously. But yeah, I mean, I'll stop talking because I can talk a lot, I guess.
That's, yeah, it's so interesting to hear that, and I think thank you so much for picking up on the importance of the unions in this as well. I think that's definitely a place that going forward the Health for a Green New Deal is going to be looking to organise. But I think you definitely touched on quite a few things there in terms of the pay and the privatisation. But I was just wondering if anyone else had any sort of, so apart from the unions and some of the other organisations that Alia mentioned, does anyone have any other sort of thoughts on where we might be organising? Rhiannon?
Yeah, I was just, sorry, Aarash, do you want to go first? Okay. I was going to say, I think as health professionals who are generally kind of regarded as highly respected, professional, well-educated people, I think we have good access to spaces that other activist voices might be left out of. And I've definitely seen that in my personal capacity as well. Like I'll start a room and I'll introduce myself as an activist, and then they'll say, oh, I'm 50 a medical student, and everyone will be like, oh, okay, we'll take it a bit more seriously then. So I think it's really important to use that privilege that we have as professionals and bring those more radical, more justice-focused ideas to spaces that can often be quite technocratic. So things like policy spaces, think tank spaces, and I think there is a lot of value in being someone who can enter those spaces because of our professional standing, but also but bringing in like much more grassroots style thinking and justice-focused lenses. And I think from my experience, so like I'm an independent commissioner for the Cambridgeshire and Peterborough combined authority, so I advise the local authorities in my area on their climate change strategies from a kind of health and kind of justice and inequality lens, I guess, and also I think from a youth lens as well. And something that I've noticed has been really valuable with me being in those spaces with that kind of more radical viewpoint is the ability to link climate policy to community priorities. Because I think especially at the local council level, I mean, not just at the local, at all policy making levels, it's really easy to silo climate and to think of climate as like nice extra things that you do if you have extra money and extra time, which nobody working in local government particularly has definitely no extra money and definitely no extra time. So it's really important when we enter these professional spaces is to bring this kind of radical linkages of all the things that we care about. Because for me, it's worked incredibly well, and we've actually had it's allowed kind of more people to be on board. Some of the councils who we kind of weren't sure about have become more involved and really supportive because we've been able to, and like credit to the rest of the commission as well, we've been able to take these ideas and link climate policy to access to better public transport, which everybody in our region cares about and will vote on, and access to like better housing that is climate friendly but also helps to house some of the poorest people in the area. We have a huge problem with homelessness but also a huge shortage of social housing. So I think and for me a lot of the justice lens has been about making sure that it's not rich areas of the region telling the whole region what to do and being like, oh, we've got the extra money to do this, so we should all do this. But it's been about taking that lens, that much more holistic, health-focused, community-focused, justice-focused lens that Health for a Green New Deal brings, bringing it to professional spaces which are often siloed and often a bit more technocratic, and using that to help bring more people on board. And that's just one example, but I think you can do it in lots and lots of different spaces. And that's something that I've found to be really, really valuable, and something that I think we could be utilising as professionals. Yeah.
Thanks, Rhiannon. So I think what I heard there was sort of organising in those professional spaces that might not necessarily have these more radical opinions, and then taking that on to councils and things like that, and making sure they've got a radical health voice in it.
Yeah, definitely local councils. Yeah, over to Aarash.
Nice. Yeah, Aarash, did you want to comment on that?
Yeah, could I add one thing in to this, which I think is important, and it's I totally agree with everything that's been said so far about you in terms of what spaces we can use to organise and put our message forward, and using our sort of our clout as people in a medical space. But I think another sort of facet to this, which we tried to put through in the briefing, is that sort of within our workspace, as within the health sector, that in itself is an important place to focus our energies in and of itself, both just because in terms of our carbon footprint, something like, I think I read it's 4.5% globally of the carbon footprint is just from healthcare, and in places like America where they've got huge bloated healthcare systems, it's much bigger than that. So focusing in on what we can do in our spaces, and then that depends where we work. So our department, so for me and LJ High, who I saw is in the room as well, as respiratory doctors, there are lots of things we can do. There's sort of selection of pharmaceutical products to reduce our carbon footprint within a hospital setting. It's sort of how we're procuring things to minimize the sort of carbon footprint from transit, which is I think the biggest source of carbon footprint in the NHS, where we get our food, waste disposal. So I think that's a really important place to start, and one way, or a really important way to do that, can be sort of making networks within our workplaces, so a hospital-wide or organisation-wide groups of us across different disciplines, or within departments, sort of making. So I think that's an important thing to add in. I'll stop there.
Absolutely, I couldn't agree more. I think like having networks sort of within workplaces is so important for the movement, and helping us spread our message, and also helping include lots of different healthcare professionals as well. And I don't know if Minna, that was something you wanted to comment on.
And I'll just, for Pharmacy Declares, there's actually a few people in it already who's done work within a kind of workspaces. For example, Alia, she is, I think, NHS Lothian. She has done a nationwide kind of work with theatres, because she's the lead theatres pharmacist in nitrous oxide mitigation. So she's working with estate engineers to reduce the supply of it based on the leakage. So that's one of them. We have contacts in the kind of, I'd say, Welsh government kind of sustainability medicines point of view, to look at work streams of, well, we're looking at polypharmacy as well, with and kind of the work in deep prescribing, because if we can reduce the amount of medications we give out in the first place, in conjunction working with patients who checking whether they're taking it or not, then we don't have to deal with kind of the wastage afterwards. So the sustainability part of it as well, we're looking at, I think this talks about expiry of medications. I think a lot of pharma industry impose kind of these expiry dates on medications that are not really scientific based. I think in America, they have extended kind of the shelf life of medication. So kind of in pandemic last year as well, we're looking at reuse of medications in kind of hospices. So for example, if a medication's never left the hospice, it's prescribed for a patient, but it's never been opened, it's in a cupboard. So looking into maybe reusing that for another patient in the premise, provided we can guarantee its integrity. So yeah, I think in Pharmacy Declares, we're also looking at kind of, so we have indemnity insurance with kind of few unions. So we're looking at asking them to divest from fossil fuels and see who they bank with. We have, I don't think we have people in our kind of General Pharmaceutical Council, because that's where we're going next to kind of implement education from a university level on the impact of medications on the environment, to see if we can introduce that into curriculum or a learning package, and that we can use in our teaching sessions. So yeah, like these workspaces that we've been working on.
That's amazing to hear. I think, yeah, coming up with those teaching resources, but it sounds like Pharmacy Declares is doing a lot of really interesting work there. And you mentioned sort of the work you've been doing with unions, but also that teaching work as well. So that's really cool. We luckily got Lesley here with us, who as well, who's now just joined the panel. So Lesley is a retired GP from Scotland, and is the coordinator of Medact Scotland. And Lesley, if you maybe just want to introduce yourself, and then you can jump straight in with the sort of, we're just talking a bit about spaces that we can organise in, but also maybe something that you might be able to bring into this is how do we include care in that organising as well. So yeah, take it away then.
Okay, thanks very much for inviting me. Yeah, I'm a retired GP. I used to be a GP in the south of Scotland. I worked as a GP for many years, and then I deviated into public health because I got really interested in the social determinants of health. And then I came back into general practice because I missed the stories and I missed the people and I missed the patients. But I think that public health perspective, particularly when it comes to the climate emergency and climate justice, is an incredibly important one. I am a coordinator of Medact Scotland, which is thriving. We're getting new members all the time, which is great, and not just doctors, all kinds of health professionals. Our particular emphasis, I think it's fair to say, in Scotland is looking at the links between disarmament and peace movement and climate justice and justice in terms of peace. We've obviously got Trident sitting in the beautiful waters of the River Clyde, not very far from us, and it's terrifying and we want to get rid of it. And so looking at the inextricable links between disarmament, the environment and health and climate justice is very much, I think, what in the Scottish group sort of focuses on. We look very much at opportunities to get that perspective and that word out there. So, for instance, for a few years, a couple of us have offered an SSC, special study component, to first year medical students on climate change, health professionals' role in climate change. If any of you, I know, if you're at an earlier stage in your career, it's hard to find time for anything extra, but if any of you have contact with people who are further on or retired from their clinical careers, the universities are always looking for people to offer SSCs, and doing one on health professionals' role in climate justice has been really popular. This is at Edinburgh Medical School. And I could talk to anybody who's interested to do that. As a GP, I'm really aware that we have now got the Greener Practice Network, which I guess other people have spoken about. Vast amount of work going on to green practices, both in terms of prescriptions, in terms of making the buildings more eco-friendly, in terms of reducing the amount of fossil fuels, car use, etc., etc. And so that's the website is www.greenerpractice.co.uk. Vast amount of really useful stuff on there. Again, people have probably referred to this, but the Sustainability Development Unit based at Oxford, huge amount of material there. No, that's the Sudanese Doctors Union. It's not that, it's something like that. sdu.org.uk, huge amount of useful information there on making our work as health professionals more environmentally friendly. I think the only other thing I would just like to say, which I think somebody just as I was coming in alluded to, is this: how we have a voice. We have a voice when we're talking to individual patients sitting in front of us, but that is their 10 minutes to talk about their COPD or whatever it is they're coming. So there's I think we have to be very careful the extent to which we take that up with what we perceive as something that is important to us in the wider perception of health, but might not be important to that person sitting there. But there are so many other opportunities to have our health voice heard, and whether that is in organising climate hustings for elections, which is what we're doing in Glasgow, thanks to Rob's very hard work. A group of us are putting on a climate hustings in Glasgow for the Scottish elections in a couple of weeks' time, whether it's writing to local newspapers, whether it's writing, and developing a dialogue with your local councillors and MPs. We have a Tory MP who has, let's say, needs a lot of educating, but we have developed a really useful relationship, and oftentimes he is very interested to hear the health perspective. You know, he genuinely, and it's such a good bridge, you know, when people have been, you know, quite rightly completely consumed with anxiety about the our response to the COVID pandemic. You know, what lessons have we learned from the COVID pandemic, response to the COVID crisis that is relevant to the climate crisis? He was in, you know, I don't know if any of you have seen Richard Horton, the editor of the Lancet's book, the COVID-19 Catastrophe. It's very short, it's brilliant. It's got every argument you need about why, as doctors, when you're responding to a pandemic, you think in the same way responding to climate. You know, prevention is better than cure. Pandemics and climate change, no new boundaries. We're only as well as the least well in our communities. The disadvantaged get hit hardest. So it's a really useful book. The other book, which I just want to flag up before I stop, is the Christina Figueres, who used to be the chair of the UN Climate Council. And she's written a book called The Future We Choose. And again, short, brilliant, just very easy, very accessible, lots of very useful information in it. So I think, you know, that's always been my perspective, that as doctors, we have particular professional training and particular skills, but we also have a voice. We're first and foremost people and citizens, and as citizens we have a voice, and because we are trained in health, we've got a particular perspective which people generally value and listen to. And if we talk about health in the sense of holistic healthcare, getting involved not just with individuals but with communities and with global health, is planetary health, is you know, is part of our professional responsibility. Just very briefly, just the very last thought is, a lot of what we're talking about can fall, as people have just been saying, as Mina was talking about from the pharmacist point of view, is social prescribing. You know, when we get into looking at a more social prescribing perspective, we're getting away from carbon-intensive drugs, if at all possible, and we're getting people into green space with the mounting evidence about the beneficial effects of being in green space. So, you know, we can kill multiple birds with one stone by moving more towards social prescribing, and that's no longer, thankfully, seen as kind of left field. It's very much you know, in the NHS plan, and it's a really good lens to see everything that we do as health professionals through.
Brilliant. Thank you so much, Lesley. You touched on so many different things there. I think you sort of answered a lot of the questions we've been discussing. And you mentioned some of the things you've got going forward as well. Just like to point out those hustings again, if anyone missed that, those climate hustings that people can attend. But I think you mentioned some really interesting things about that holistic view of things, and I think when thinking about how we include care in this organising, getting that holistic vision is really important, and that holistic lens. Thanks for bringing that up, Rhiannon. Yeah, go for it.
Yeah, I just wanted to add something to your question about what spaces we should be organising in, if that's okay. I think it's really important as health professionals to also think about the limits of our profession, and where only working within our profession is gonna let some patients down. And I think what I mean by that is it's quite easy, I think, when you've got an individual patient in front of you to think about them as an individual, but a lot of the time what we need to do is move like way beyond that. And I think that's where the health profession should do. I think we're very good at campaigning on health sector specific issues like privatization, but I think we need to be quite a lot better as a profession at reaching out to people like housing rights movements, people like movements like the Deliveroo strikers for more secure work, people who are working on refugee and migrant rights, people who are working in their local communities on food security. Because I think these are health issues, and I think, at least from my experience, I think we should be doing a lot more as health professionals and climate and health justice activists to go beyond our profession and make sure that we're making the links with those groups as well, and talking about how it's not kind of one issue versus another. Like, it's not, climate versus health, and like, oh, which one are we going to prioritize, and oh, if you guys are working on housing rights, we don't have time to do X, Y, and Z. But we need to, I think, be a bridging force as well, and talk about how the things we want for climate and health justice completely align with what you're fighting for, but also like learn from those movements as well. They have like a very rich experience in organizing and in tackling systemic issues, because I think it's especially because of kind of the individual doctor-patient relationship, where it's much easier for us to fall into the kind of smaller scale, whereas people like who work on housing rights are very anti that. They're very like, oh, well, if people haven't got a house, it's definitely not their own fault, you know. And I know none of us think like that, but I think just those movements that are a bit more systemic and work in that way and are so connected to what we want are super, super important for us to link up with as a profession as well, both strategically, but also I think so that we can learn as well. So I just wanted to add that as an organizing space.
Absolutely. Thank you so much for bringing that up. I think that solidarity with other movements is absolutely how we're going to advance this movement and be heard on a bigger scale. And we're going to need to bring everyone along with us. Yeah. And I think thinking about the sort of the way we take that forward and how we include lots of those different voices, but especially some, you know, the communities who are going to be impacted the most. Like how are we going to bring those people along? How are we going to reach them in their spaces? And, you know, what does it mean to sort of practice and listen to patients and their needs? Yeah, Alia, go for it.
Yeah, hi again. I just wanted to sort of come in off the back of what Rhiannon said and what you were just saying as well about solidarity with other different sort of pockets of struggle, let's say. And yeah, just to sort of continue that point that everything is linked, and that's become very, very clear. That's become much more clear over this past year. It's become very clear that decades of neoliberal capitalism have created the conditions within which pandemics can thrive and in which society's defences have been broken down, allowing for its rapid travel, rapid movement around the globe. You know, we can see that with certain places not being vaccinated because of certain other places not thinking in a global way or in a slightly more kind of in an anti-capitalist way. You know, when we're thinking about money, then everything suffers apart from that very small pocket of people who are sort of, you know, growing their wealth. Obviously that's not going to make things better in the long run. It's just going to make things much, much worse. So in that way, capitalism is quite counterintuitive, because it's killing all of its workers and it's killing all of its people. It's killing all of it. It's killing the earth. There is nothing going. There won't be anything left. So when I mention in terms of the conditions in which pandemic, you know, what I'm talking about is unregulated development and destruction of the globe, of the ecosystem. Sorry. For example, but also the dismantling and privatization of healthcare services and healthcare and welfare infrastructures. You know, these are the things they all go together, and it's all sort of there's one root cause of it really, and it's clear what that is, and it's very important for us, I suppose, is my main point, to bear that in mind always. You know, the planet, you know, the sort of climate struggle is exactly the same as the women's movement, is exactly the same as the struggle as a Black person. It's exactly the same as, you know, a single mother in poverty or whatever. It's all the same stuff. It's all the same struggle. And in order to deal with anything effectively, including this pandemic and future pandemics, we really have to reconsider everything and reconsider priorities. And so, yeah, I suppose bearing that in mind is definitely important. I agree.
Yeah, thank you. Yeah. Aarash, did you want to jump in on how we might be able, you know, sort of Rhiannon and Alia have mentioned lots of different communities that are affected by things in different ways, and how we restructure things and the way we think and how we go forward, but how do we bring along the people who and communities who are most affected by these changes, by the climate, by yeah, how do we bring them along with us, and how do we make this an inclusive movement for them?
In terms of how we do that in our role as health workers, I guess agree with what the others have said, and another thing that comes to mind, in fact I think Lesley touched on it as well, is for those of us who are sort of patient facing, helping the people that we see and their carers and their families to sort of see the bigger picture in terms of where their health is being impacted by a global picture. Say that the obvious one is with air pollution. So there's now more and more guidance for clinicians who are dealing with people who are feeling the effect of air pollution directly with their health, to issue specific guidance, for instance, with people who've got asthma or chronic obstructive pulmonary disease, emphysema, who suffer with worsening of their breathing when the pollution indices are high. It's actually part of our job to give them advice about how they can avoid those kinds of things and take different routes. In some cases wear masks, in some cases don't walk when it's, you know, if the only option you have is to walk near a road, it might be better to exercise indoors. But then also to sort of just mention that, by the way, it doesn't have, you know, pollution is one of the things that's impacting you, and then they might take that on for themselves, that they become an activist and they sort of start to feel those impacts. And it's the same, perhaps to a lesser extent, for other people that have conditions that we know are likely in some cases to have been impacted by these types of issues. And I think it's important, obviously, for us not to overplay our hand and not to abuse our position as healthcare workers, to say, you know, I've taught, you know, for instance, I'm a doctor and I'm saying that your problems are all caused by pollution, and therefore I'm telling you that you have to go and become an activist. That would be, you know, wrong. But I think at the same time, it's negligent not to bring those things up, at least in terms of sort of providing the people we're looking after with the information and then letting them make their own decisions. But I think so far, we haven't really done enough, and we haven't spelt out clearly enough that sort of society's ills are impacting some people, particularly our patients that we're seeing, disproportionately, and we should at least give them that information and then let them do what they want with it. And hopefully in a lot of cases that will be not just changing the way they act, but telling other people, by the way, my asthma is made worse by all these cars. I think we should all, you know, start to talk about it and do stuff about it. So I would add that in, I think.
Brilliant, thank you for sharing that. I think, yeah, starting those conversations, though difficult, could be, you know, really important. Minna, did you want to say anything to sort of how we work with different communities who are affected by these changes that we're seeing at the moment, or how we tackle the root causes of those injustices?
I think probably we'll all need to sing from the same hymn sheet almost. So if I say something to a patient today, and I don't know, for example, I think maybe you should consider a dry powder inhaler because you've not been using your evohaler very well. You know, evohaler propels hydrofluorocarbons, which is greenhouse gas. So then, and then the patient is a bit unsure, and then goes to their own GP and said, "Oh, what do you think about dry powder inhaler?" And if the GP says, "Oh, I think they're rubbish. I think you should just stick to what you know." So then that kind of confuses people, and we're not sending the same message. So I think we're kind of, and then it then cascades down to giving the same information. So in terms of teaching and made people, healthcare workers aware of what the different green movements are doing and what the Green New Deal is, and kind of made them aware of what we're trying to do. So when some groups are trying to say something and gives a message, it doesn't get vilified by the other group and to be something else type of thing.
Yeah, nice, thank you. I think, yeah, having clear messages and clear information, I think that example of those different types of inhalers is quite a good one. So just sort of going forward from here. Oh yeah, Rhiannon.
Sorry, unless, does anybody else want to add anything to that question? Otherwise, I just wanted to add one thing. Okay. Yeah, I think it's really important when we think about how we bring in different communities as doctors, is that we, and I think I kind of touched on this earlier, but we recognize like where our own limits are. So for example, like in medicine, we are trained to like, you have knowledge, people have needs, you impart that knowledge and you hope that they go and do something about it. And I think that when we're talking about climate change, we need to be a bit more imaginative than that, especially when we look at like collaborating with other movements. So I think conversations with patients is great, but then we've got to be really careful that we're not saying climate change is your problem and not a collective problem. But I think, you know, as medics, we are taught and trained to be like, you have the knowledge and other people need your knowledge, right? Whereas actually a lot of people don't need to be kind of educated about how their shitty living circumstances impact their health. They definitely already know, and they probably know better than you do. So I think it's really important that we as doctors, and we're not trained to do this, in fact I think we're trained to the opposite, to come at this from a place of humility and a place of learning and a place of, well, we know what our skills are, and we would like to add them to your struggle, and we would like to add them to the climate struggle, rather than saying like, oh, like we're doctors, we're gonna come here and educate you, isn't that great, you're so lucky, like did you know this, I bet you didn't. Like, it's like, that's not gonna allow us to build that solidarity. So I think we need to come at it of a place of health professionals are important group of people to organize, an important group of people to mobilize, an important group of people to deal with the problems in their own sector, but also are very able to raise the problems more widely in society, but come out of a place from, we are adding our voice to existing struggles that have been going on for a long time, and a lot of the time they are struggles that we know about in an academic sense, but not necessarily in a personal sense, and obviously that depends on each person, of course. So I think it's really important for us to kind of call ourselves in as doctors or nurses, as pharmacists, as professionals, and be like, well, is the way we've been trained different to how we would want to work together in this better future? And I think it definitely is.
Brilliant, thank you. Yeah, Lesley.
Yeah, I mean, I totally agree. I think, you know, I think as health professionals, we do have a special voice, but you know, there are so many other people who have their own special voice, and you know, what everybody needs to be doing is listening. You know, we can talk, but we need to listen first. And I think, really, you know, positive, healthy relationships with patients, as with individuals, as with communities, are reciprocal. You know, as you were saying, Rhiannon, you're learning. You know, it's mutual learning, and it's. I think saying that as health professionals we have a specific voice isn't necessarily saying our voice is better or worse than anybody else's, but it's just simply acknowledging that we do have a voice, and you know, with that voice comes a responsibility to use it. And part of that, I think, is encouraging other people to use their voices. And I think connected with that for me is you use the word humility, and I totally agree. And that's about self-honesty and about being honest about, you know, what we can do, what we can't do, how we feel about things, you know, when we're feeling overwhelmed, when we're feeling frightened, you know, being able to acknowledge that to ourselves, but also to a trusted other. And that's, I think, fundamental for our health, and therefore for the health of the people we're trying to help, whether it's individuals or communities or whatever. I'm the co-editor of a little book of poetry called Tools of the Trade, which is published by the Scottish Poetry Library and is gifted to all Scottish medical graduates. And the idea is that it's a little book of hopefully helpful poems to nourish particularly junior doctors when they're going through the first very scary first few years of being doctor, and something that where they are encouraged to to have self-compassion first, and to nourish their creativity. And I think those things, you know, being aware of looking after yourself and nourishing your creativity are really important in being able to fulfill potential, both as doctors, but also as activist doctors.
Brilliant. Thank you, Lesley. And I think that the idea of humility and recognizing our voice and how we can support the voices of others, and recognizing the different places we come from and our different narratives, and how we bring those together to make a movement. So important, and how we nourish ourselves as well during that. So sort of looking forwards now, I had a question in the chat, but also just wanting to know from each of you, so going forward, if you were to say to everybody listening here, one thing that they could go away from this gathering and do, how they could be part of this movement, how we're going to continue building this movement, what would you say to that? Aarash, would you like to start with that?
Thanks, Jess. Yeah. I think I don't want to cop out, but I think that it's for everyone that one action is going to be different depending who you are and what space you occupy and what part of this is most meaningful to you. But one unifying thing, I think there's an action which is to involve your MP and arrange a meeting with them for local health for a Green New Deal group. And Rob and I think Ben is setting up training sessions for how to lobby your MP. And I think for me, that's one thing that sounds really, really exciting. I think everyone should strongly consider getting involved in that and taking the fight locally.
Brilliant, thank you, Aarash. Alia?
Yeah, I suppose getting involved wherever you can, I think, is important. Being aware of people who are struggling in your local community and helping them, and getting involved with that. Obviously, getting involved in any organisations that you know about, and a trade union, and that's not sort of, yeah, that's quite different to organisations like Keep Pharmacist Public. I guess if you are in the NHS, then get in touch with us at NHS Staff Voices, please. It'd be great to get more people involved in that, and you know, it's again just reaching out. We basically try and get voices out there as well, and so there are so many things I've heard today that a lot of people in other parts of the movement won't have any of this information. I certainly didn't know a lot of the stuff that I heard today. So getting more involved, I suppose, in other parts of the movement is really important, because it feels as though this stuff is all quite new to a lot of people who've been activists for years as well. I think there's a huge movement, and there's not much of it is thinking about this stuff, but they're thinking about it on a different level. So they're thinking about other parts that all join up. You know, as we've been talking about today, everything joins up really, and a lot of us sort of lobby our MPs, but we don't think to lobby them about the things that we've been speaking about, or I've been hearing about today. We just wouldn't think that, you know, with, you know, migrant charges, or, you know, things like that are really important. PPE is really important, but we're not, you know, and both of those things are intrinsically linked with the climate. You know, wasteful PPE, like wasting so much PPE, so much of it has been wasted over this time. So much money has been wasted, so many resources have been wasted messing around with PPE, and we still don't have protected staff. So obviously these things are all really, really linked. So I suppose just, yeah, speaking to people that you didn't think would need to hear about the very basic key points that you know, you must have been talking about over these 2 days. But speaking to people like me, or, you know, in the movement, we don't know about this stuff. We really don't think about this stuff. So yeah, maybe just not assuming as well that people don't, or that people know this stuff is important, because lots of educated people don't.
Brilliant, thank you, Alia. I think that starting those conversations around those things, but also connecting with other struggles as well, is what I heard in there. And the way to do that is, you know, in the NHS, trade unions, you know, being part of those trade unions and starting those conversations in those places as well. So thank you so much for that, Alia. Rhiannon, did you want to speak to that?
Yeah, I think definitely, I think for me, the most important thing is to do whatever you want to do in a group and with people that you like, and you can care for each other and do it together. Because I think especially in medicine, but also in our society in general, we're very highly individualized. We think of success as something that you achieve as an individual, and woo, I'm going to change the world by myself. Nobody has ever done that, and you will burn yourself out trying. So I think it's really important to, whatever you want to do it with a group of people. So for example, in Health for a Green New Deal, we're going to be looking to set up local groups, Students for Global Health. We have a group at each university. So that's kind of one basic way. So whatever you're doing, do it with a group of people, because also you don't know, like there's a finite amount of good ideas in your own head, right? And like the more that you do it with other people, the better ideas you can have as a collective. So yeah, whatever you want to do, I would say find a bunch of people, only like 2 or 3 if needed, and do it together.
Lovely, thank you. Minna?
I have 2 points really. I think one, probably stand in solidarity with other healthcare professionals when they were having a movement or campaigning for stuff. For example, in pharmacy at the minute, I tweeted this earlier today. I don't know if everyone's aware, there's been cuts to pharmacy services over the last few years, and a lot of pharmacies are at risk of closures. So I think within a vicinity of everybody where you live, there might be a pharmacy within 2 miles. There might not be that in the future, which means increasing in carbon footprint of patients having to travel further to reach to a pharmacy to get healthcare access, which means social inequalities because one area might have access to pharmacy and one area hasn't, and increase in the GP workload because all these minor ailments that could have been concluded in a pharmacy is now gone to GP or the A&E. So that's number one. And number two, I was reading through the public health case for the Green New Deal and kind of thinking, how does healthcare workers fit into kind of advocating for better housing and for increased energy efficiency? And then I started thinking about when we clerk patients in our ward, we ask about our social history. And then, for example, if someone has poor mobility, refer them to have kind of a stair lift installed, etc. Is there scope for work to get a house assessed to see if they can be retrofitted for a better insulation, better energy efficiency, because these elderly people who live alone can need to pay their own bills, and then so that might be an opportunity for us to make an intervention, because I think every healthcare work interaction is an opportunity for intervention. So yeah, just 2 points really.
Brilliant, thank you. Yeah, I think that's really interesting, thinking about ways that we can use our patient interactions to take interventions forward. I think that's really interesting ideas. Lesley, did you want to speak to that?
Yeah, just I think going forward, I think one of the key things for me is for people, you know, in the past, there's been a dichotomy between being a good doctor and being some kind of public activist, or, you know, politically engaged, or a health activist. And the message that is getting out there, we really need to get out there more and more, is that it's not either or. That, you know, in order to be a good doctor, you need to be a health activist. And actually, it's interesting, if you look at what the GMC, I was involved with the Doctors for XR, and there was a lot of concern when people were getting arrested that, you know, it might have the GMC, General Medical Council, might hold it against them. So we did a lot of research into that. And actually the GMC on their website talks about the responsibility of a doctor being to provide care for patients and to promote the public health. Well, you know, there's not much promotes the public health more than working in climate activism. So actually, you could say, and this is what Richard Horton, the editor of The Lancet, says, you know, by being, you know, you're obliged, it's not an option. As health professionals, we are obliged to be health activists. And I think anything we can do to get that message out there is really important.
Amazing, thank you so much, Lesley. I think those are really important words for everyone to hear, especially at the end of such a interesting and motivating weekend. One final question from the audience is, a lot of people have talked about how there are a lot of different movements and we want to work alongside them and support them. And one of the questions is how do we sort of get all these movements to sort of work together, and I think it's obviously everyone's passionate about their own issue, but how do we sort of work together? Does anybody want to speak to that finally? Just a quick answer. Yeah, Rhiannon, go for it.
Yeah, I can give a quick answer. I think firstly, it's not on like any one part of very wide-ranging movements to make them all work together. It's like a very movements are very, you can't ever really control anything, so all you can do is try on your side. But I think the most important thing is to put forward a vision of what you're fighting for and how that vision aligns with other people's, because I think it's really easy to get lost in reactive advocacy, being like, we hate this is bad, which many things are, and we hate many things. But I think it's long term, especially when we think about movement building and movement strategizing, it's really important to have that vision of where you want to end up, because then you can say, look, we want to end up here, and that's where you guys want as well. And I think for us, that vision, or at least for me, that vision is kind of along the lines of, well, what different world would we have if we prioritize the health of people and the health of planet in every decision that we made, right? Because then it's not just about one sector, it's about the way that you design your society and the way that you design your economies and communities. And I think having that sense of like long-term big picture, what is the thing that we want to do in the way that we want to design our societies, is a really powerful way for bringing different people together.
Very well put, Rhiannon, thank you so much. Yes, Alia, just a quick one, getting to wrapping up
very,
time.
very quickly, just supporting other movements really, I think, is really important, and sort of showing solidarity, and that is the only way I think we're going to be able to work together, because as Rhiannon said, you can't control anything, you can't control what other people do, and sectarianism is a real thing and it's a real problem. But if we support other movements or other parts of the movement, then they will inevitably want to work with us. It's really that simple. And so I can't remember who said something about reciprocity. I think that, as a psychotherapist, obviously I would say this, but I think it's in everything, reciprocity is the only way that you really get anything done. Solidarity.
Absolutely, thank you so much. I think that solidarity, reciprocity and humility are some of the key words that have stuck in my mind from today's discussion. So yeah, just getting to the end of the session now, and just want to say a huge thank you to all of the panel for sharing their time with us, and wise words and motivation as well. And thank you so much to everyone listening in as well, for your questions and your comments and your shared knowledge as well. It's been really lovely, like watching some of the stuff come through on the chat. And so, yep, obviously going forward, we've just had, an incredible weekend of knowledge sharing and information, and it can be quite overwhelming, but I think, taking some of the actions that these guys have just talked about now, maybe writing down one thing that you're going to do this week or next month, and gathering people around you as well, starting those conversations in the workplace, in the unions, with your counsellors. You guys have got the tools and resources now. You've heard how important your voice is to go alongside the voices of others. So yeah, I really would urge you to use this weekend as motivation, just to start campaigning and start being, and become part of the movement. This being part of this group for me has been a hugely important sort of life raft, sort of keeping me afloat in all the doom and gloom sometimes, and it's really an incredible thing to be part of. So I would really encourage you all to get involved.